Started. Namaste and welcome everyone for today's webinar on Ayurvedic first aid and home remedies. Our guests, our faculty, the amazing Dr. Aparna Bapat. Aparna ji is a distinguished Ayurveda practitioner, educator, and entrepreneur, having worked in the United States for 25 years. Dr. Bapat earned her BAMS, the Bachelor of Ayurvedic Medicine and Surgery, from Pune University in India in 1990. And after an internship in 92, she joined Ayushakti in Mumbai, where she honed her Ayurvedic skills in Ayurvedic pulse reading and Panchakarma treatments under Dr. Naram. I do have a lot of background noise. I'm at the Gujarati Physicians Conference. Aparnaji, we were talking about you. Just met Dr. Mark Halpern again. He gave a little talk. So I'm going to keep it short and just give a brief introduction about our subject, Ayurvedic first aid and home remedies, and hand it over. And we know that Ayurveda offers swift remedies for many common ailments, serving as both first aid and preventative care. And Dr. Aparna Babat is going to get into a lot of those details, answer your questions, and engage with you today. It is my pleasure to host. Sorry for the background noise. I'm just going to hand it to Dr. Babat to get us going, and I'll be in the background supporting for the webinar. Thank you, everyone. Appreciate you joining. Aparnaji, sorry for the short introduction and the background noise, but I think you can handle it. I'm going to hand it to you to take it away.
Thank you so much, Ankurji. Namaste. Namaste, all the participants in this webinar. I'm very excited to, give this summer semester one more time the Ayurveda First Aid and Home Remedies course. And I hope you all can participate and join. It's a very exciting topic. As you all must know that Ayurveda has to some extent got kind of a bad name that whenever you go for Ayurveda remedies, it is going to take a long time. You cannot do anything with Ayurveda for like a instant relief of any type of ailment. So we are trying to kind of debunk this kind of thought process if anybody has, because understand Ayurveda is a science of life. So everything that we come across in life, whether it is our food, diet, lifestyle choices, our way of thinking, our daily routine, everything matters. So any little change that we can make in that quick and fast enough to get a instant relief from any symptoms or even any disease pathology that can kind of groom into a bigger problem for us later. So all that can come under the topic of home remedies and first aid. So in this particular course, which will run over like 10 weeks, so it will be one uh, class every Monday from 8:30 to 10, but we usually go a little longer, about half an hour, sometimes even longer, because people are very passionate. They want to ask questions. There's a lot of things that are very interesting that we kind of discuss on as the class evolves. So initially, like if you are completely unaware of what Ayurveda is, we kind of give a little brush up, a little idea about Ayurveda, the science of life and science of healing. So we get to know each of you participants as an individual in the class based on the Prakriti analysis. So we, as a part of our first class, we also shared with you a questionnaire which you can fill and submit. So we get to know a little more about you. You can also know a little more about yourself, because remember, Ayurveda is also a tailor-made science. So we understand that every individual is a very unique entity. So even when we are saying that we have first aid and home remedies, every time, every dose, every remedy, or every formula, every combination may not be a one size fits all. It can be tweaked a little bit based on the personal information that we have about the person. And if you are using it for your very close family, very close friends, your own self, then you really need to know what is your mind body constitution. So our class kind of starts with that information, and then we build up, we grow on the on the three dosha theory, which is very fundamental to Ayurveda. We understand that our body and everything around us, all matter, is made up of five elements: the food that we eat, the environment that we live in. So everything is made up of a combination of these five elements: space, air, fire, water, and earth. So any substance or any environmental factor or any matter which is like water, mud, air, soil, minerals, anything that we are going to use is going to contain a combination of these five elements which impart their energies into that matter. So when we are going to look into different remedies, we also need to know what is a composition of our own body in terms of these five elemental energies, and that is where the dosha theory or the tridosha prakriti theory comes into play. So everybody can have all the vata, pitta, and kapha, three doshas to like have a successful digestion, metabolism, growth, balance, and equilibrium in their functional, pathological, and physiological systems. But we also have a unique combination. It's like our fingerprint. We are completely unique, though we are all human beings. We will have a very unique personality, likes and dislikes, physical appearances. So that is how we identify a prakriti of a vata dosha prominence or a pitta dosha prominence or a kapha dosha prominence. And based on that, whenever we are suggesting a home remedy, or like a formula, or like possibilities that this person may have this problem and how to prophylactically address that even before the problem begins. So first aid and home remedy doesn't have to be like always when the problem arrives. Many times we can use this knowledge, this information to refrain or to stay away from certain problems. So for example, we do a class with of the 10 classes that we have divided the whole portion, one of the classes we teach about seasonal home remedies. So every season can affect certain group of individuals. Like we are very familiar with seasonal allergies. We are familiar with people having hives, rashes in summer, or headaches or diarrhea in summer. Then we are familiar with people having cough, cold, nasal congestion, and all these seasonal allergies in spring in different types of weather conditions. So we also know that people in US, they live in different time zones and in different terrains. Some are mountainous, high altitude, and some are sea level, or some is more areas are more humid, and some areas are very dry and cold. So based on all this, like what kind of constitution can have more issues living in that area, so we can suggest some home remedies so that they can stay away from these possibilities. So that is one thing we will discuss during the course. One of the things we discuss also is about women's health. So the homemakers who are actually going to take care of their family, their children, their spouses, their aging parents. So they play an important role in how to deliver on a day-to-day basis something that is more of a medicinal value, something that they can use in their daily life, when they are cooking, or when they are when the child is sick, with simple things like just a slight body temperature or a small cough or sneeze. Then they can use certain herbs right in from their kitchen, and then they can help their family. They can also help themselves, because many times we see women tend to take care of everybody else, but they are not really looking for caring themselves that much. So we want to address that issue as well. Many women going through menopausal stages, they have so many home remedies that they can use to feel very comfortable, not having hot flashes, or not having all this bloating or anxiety or indigestion. So we will discuss a lot of these formulas. Then we also see that from childhood to adulthood, and as we age towards our senile years, senior years, we will have different stages of life that a human being goes through. So all through these ages of life, we can be a little bit readily prepared what we are going to expect, and then we can plan some remedies well in advance so that we won't have to succumb, or we won't have to have that kind of a symptomatology. For example, in youth, many people go through acne, they go through hormonal changes that can cause a lot of things which doesn't necessarily need a doctor's intervention. So we can treat a lot of these issues, a lot of these symptoms by simple changes in diet, lifestyle, and taking some herbs and teas that are right in your kitchen or right in your patio garden. Something like aloe vera, or something like turmeric, something like cinnamon. So many remedies that we can use also for our metabolic problems. So we see people in the middle age group that have diabetes, hypertension, insomnia, weight issues. So we can address a lot of those issues by just focusing on herbs that we use in the kitchen, like cinnamon, turmeric. These are anti-inflammatory. Ginger is another great anti-inflammatory and can take care of so many digestion and other issues. We will also discuss something to boost our immunity, because during the COVID times we saw that there was a very limited access for people to really have doctor's appointments. A lot of people having HMO plans, or like having issues with insurance, or not having access or ready quick appointments to the doctor. They don't want to be left out or left without any kind of medical care. So Ayurveda is a science of medicine in India. So it is definitely a medical science. So if you can access any qualified Ayurveda medicine doctor, which is a BAMS or a MD Ayurveda from India, they can definitely help you. But in the meantime, that you can get any professional medical help, there are many remedies that we can do at home, very safe, very easy, and very effective. So that is most important, that they are effective. So we are not trying to promote that don't go to the doctor for your issues. Definitely go there, but till you get the doctor's appointment, or till you have access to a professional medical facility, Ayurveda can definitely take care of you and subside a lot of your symptoms and issues by following the Ayurvedic home remedies and first aid protocols. So we'll be discussing a lots and lots of topics on geriatric care, on child care, or different age groups, different seasons, different specific problems. And then we also take input from any of our participants, our attendees of the course, that they want to address a specific home remedy challenges. Like in one of the courses, we had somebody with fungal toenail going on for a long time. So we kind of address that as a part of our class. We try to do a few hands-on workshops and things, not workshops, I mean like demos, I would call. And so I give some homework, which is theoretical homework, and also some practical homework. So something that you can prepare at home, something that you can we can do together in the class, though it is an online class. If you have a list of certain ingredients, we all come prepared on the date of the class, and then we can cook, or do that particular recipe together. So there are many such things for self-help and for first aid and home remedies that we will be discussing. I have I see some of the messages here, but I would like to open to the participants if you have any specific questions about whatever I just discussed with you.
Yeah, Aparnaji, if you can go through the Q&A box, it's a little bit hard for me with the noise, but just to get us started,
Right.
Kumuji is asking
I'm
about
just
the Kerala Center of Ayurveda, and maybe some other examples of what's going on. And of course, our own California College of Ayurveda, where you come from. Of course, there are some that are true to Ayurvedic true knowledge, but go ahead. Sorry about that.
okay. So I think there is somebody asking about Kerala Center for Ayurveda. So I didn't understand the question. Why is Kerala Center for Ayurveda? Are you saying like why Kerala is popular as a tourist destination for Ayurveda? Is that your question? Um, if we can give them a chance to unmute, maybe I can.
Yeah, can you hear me?
Yes.
Okay. I have asked so many people that if they can tell me a good Ayurvedic, a center, and in India, and almost 99% of the time they say Kerala has very good places. You should go to you should look in Kerala. So why Kerala? Isn't there anything in the north, or I mean, I don't understand.
Yeah,
So
there are
that
absolutely. There are centers all over India in Rishikesh, Delhi, in Gujarat, Maharashtra, even Udupi, Bangalore. Like you can find places everywhere. Kerala is popular because they have, first of all, marketed it internationally very, very well for almost 2 decades. So last 20-25 years, Kerala has really become a health tourism destination, fully focused on Ayurveda resorts and Ayurveda Panchakarma centers. They have a slightly different style of treatments, and people flock there from all over the world. So yes, they are kind of well established in that sense. There is also Ayurveda Shala and some of the very traditional hospitals, you can call, like you can go and stay there, get admitted and take treatments for a month or 2 months in the southern part of India. So some places are very commercial now. In fact, if you travel to India, a lot of places you may see they offer a Ayurveda spa in their like in the spa section. There is a menu for Abhyanga, Shirodhara, all these things. But those are not real. Those are not treatments. They are just like a superficially feel good kind of things, which are good for relaxation if you're traveling and if you just want to get pampered. That will be something you can look at. Uh,
So an offshoot of that question, and then I have a second question, and I'm done. The offshoot is that I also heard a lot about the Ravi Shankar, that that Swami, he conducts, and the people swear by the effect, the difference that they feel once they go to his, these treatment centers. So that's one. And the last question is, I was told that Maharishi Atreya was the founder of Ayurveda, so to speak. So, do we have schools today that teach that or follow that kind of Ayurveda?
Yeah, so we all the schools that are traditionally rooted in Ayurveda will follow the Bruhatrayi, Charak, Sushrut, Vagbhat, and of course Atreya, Punarvasu, everybody's teachings. And Atreya per se was not the founder or anybody of Ayurveda. There are texts written in the Vedic scriptures from Atharva Veda, and also Ayurveda originated from the blessings of Lord Dhanvantari, who is the avatara of Lord Vishnu. From Samudra Manthan, he brought Ayurveda to mankind or human beings, and we worship Dhanvantari, Lord Dhanvantari, as the devata of Ayurveda. So yes, any traditional school will be teaching on this format. We in fact have a accreditation council that I'm the president of, and at the Hindu University Ayurveda College, we are putting together not just the Ayurveda curriculum for a full-time Ayurveda medicine degree program, but also a Panchakarma center. Right now, as you mentioned, Sri Ravi Shankar has one in North Carolina, I think Asheville or somewhere. So that center is there, but we will have one here in Orlando in a short time, where people can come and stay and take full Panchakarma treatments. You don't have to travel all the way to India for doing that. Okay. So there are remedies for. I hear you writing about brain tumor. So brain tumor is a very complex pathology. It can have, some remedies that we can suggest as the person is taking some allopathic or any medical treatment. We can definitely help for with certain herbs, with certain like simple remedies or protocols that they can follow on in their daily life. Meditation, pranayama, that can be very helpful. Gold infused water can be very helpful. Using turmeric as a medicine, as a remedy, can be very helpful for tumor regression, especially if it is if it is carcinogenic or carcinogenic, doesn't matter. The turmeric has always shown to help with creating like shrinkage of tumor. So, certain remedies can definitely help them as they are pursuing the medical treatments. Okay. Okay, so I see nutritionist course at Ayushman School of Ayurveda, Rishikesh, with the course. Will this one further your knowledge? I'm sure if you are doing a course on nutrition, you may be familiar with some of the things that we will be teaching, but I think this will definitely be a good addition to your course. Okay, then yes, so that is why we share with you a standard format of a questionnaire for determining somebody's dosha. And that comes, of course, with practice. But as this is a very, very small, 1.5 hour per week, like a short course of less than 25 hours, I would say you should uh, you should be like well versed with the basic concepts, but to get somebody's dosha properly identified, there will be a better option, that is find Ayurvedic Vaidya in your area who can help you with that. But many times, the self-help questionnaire gives you a fair enough guidance on what your constitution will be. Because one more thing is, like, we should really know ourselves very well, because it's all about our life and our choices, and if we don't know us, then who else will know, right? So yeah, the dosha analysis is important for everyone, and we help people to understand that for themselves. But for understanding others, it's better to have more practice or more of a advanced professional who can. So yes, for psoriasis, for skin conditions, we discuss different home remedies, and there are medicated ghees, or you can use aloe vera gel. You can also make some changes in the diet, add some herbs and teas in your daily routine, and that can help to a good extent with basic symptoms of burning and itching, and a lot of people have difficulty to sleep at night with the psoriasis, or the flare ups, like if they are more in humid damp weather during summer, or if they are more like scaly flaky during winter and dry months. So based on that also, we suggest different types of remedies. As I said, it's more like an individual understanding of what will best suit you to do at home. Does Ayurveda have any remedies to shrink enlarge prostate? Yes, definitely there are remedies. There are herbs, simple herbs like cumin and fenugreek that can work on that. There are also like saw palmetto and some other remedies or teas that we recommend. So yes, we will discuss some of these specific things, but lot of things, they we will discuss more about the general things. If it is for a specific individual, then they would need a Ayurvedic consultation from uh, Okay, do you have any recommendation for practitioner in Tacoma, Seattle? Um, well, there are quite a few people in that area, so certainly we can help you finding one. There are certain websites which also have directories for nationwide, practitioners of Ayurveda, BMS Ayurveda. There is a group of the Ayurvedic Vaidyas from India, yeah, and I can definitely ask around to give you a few names, specifically from Seattle area. Yes, eczema for teenagers. Again, skin conditions are very common. That is the pitta stage of life. So, a lot of people come with eczema, acne, pimples. So, we do have remedies for that, and how they can make changes in their diet, how they can have good bowel movements and clean intestines and keep the blood and the lymphatic system clean with certain remedies and recipes, and they can definitely get rid of those kind of symptoms. So as I mentioned, a lot of these things may not always require medical attention. A lot of things can be taken care with things that you can follow at home. So I have let me see a couple of my students that were in the last class which we had hosted last summer. um, if they are present, maybe we can have them talk a few. Ankuji, are you?
Yeah, Bimlaji, go ahead.
Namaste, Aparna ji. Namaste, Ankur ji.
Yes.
I just wanted to say that I knew nothing about Ayurveda and really nothing about my own body type or mind type or anything. And I just saw this course advertised last July, and I thought, and also I was having health problems. So that was the push that I needed, that I need to find out what I can do to help myself. And by chance, it coincided with this course being available. I signed up for it. And I told Aparna ji after the course that this is literally the best thing I have done for myself. Like she said, the women take care of their spouses, their relatives, their kids. They don't do anything for themselves. And I felt after all these years that I was finally doing something for myself. But what an eye opener. I had no idea what doshas are and how your lifestyle and your dosha determines, how your health is going to be. And I mean, it's like I feel like I was unconscious all these years, and now I have become conscious after taking this course. There's so much information. I mean, literally everything Aparna ji said, I would really want to repeat it. Of course, I don't have the mental bandwidth to do that, but you will be so happy and so grateful that you took this course, because it will change your life. Already my health has improved. I have become so conscious about what I eat, what time of the day I eat, and my lifestyle, when I rest, when I'm active. The whole, it's like waking up. And of course, the remedies are all there. I have a notebook full. There's lots of notes, and you can just go back there and refer to them if you feel there's something there that you need to fix for yourself. I cannot recommend this course enough. whether you're unwell or well, I mean, it is an awareness I feel that every human being should know. I wish we had been taught all this in school, but never too late. So please sign up for this course. Of course, Aparna ji is great, so patient, so knowledgeable. And like she says, the class will go over time because she's so happy and willing to help you out with your questions or particular issues you might have. So thank you, Aparna ji. You have changed my life. And
Vimlaji.
please, everybody, take this course. You won't regret it. You'll be so grateful. Thank you.
Thank you, Imlaji. Thank you for all your wonderful words. And I'm sure, you know, Ayurveda should be at in our schools, in our if we have grown up in India, a lot of things have been kind of familiar to us as a part of our culture, upbringing, and growing up, especially if you had chance to grow up with your grandparents. Lot of these home remedies, you may have some recollection of certain things because every household traditionally in India would contain one of these uh, we call it like grandmother's medicine box, and that those wonderful things like a little piece of sandalwood, a little piece of red sandalwood, a little piece of dry ginger, and a little bottle of castor oil, and a little you know, vial of some other things. I mean, it was like a memory come back when I started learning Ayurveda, that this is something I grew up with. Or even seasonally, how our grandmothers or mothers would make changes in the diet, or like prohibit us from eating certain foods in certain times of the year or certain times of the day, and that was all knowledge from Ayurveda. So yes, this is something for everybody, like a nice introduction to this amazing science of healing. And as I again and again want to insist that this is medicine, this is science, very scientific, but at the same time, it is very accessible to us, being a part of our culture. And lot of things we use are going to be in our vicinity, in our kitchen, in our garden, and in our environment. So yes, I would encourage all of you, if you are just curious, if you really have health issues, or as Vimlaji said, even if you are not having any health issues, do join. It will be very exciting um, to meet all of you in the class. I see a couple of questions that I would quickly go over. So again, something about white matter of the brain. So all these are like specific pathologies, but as I said, in the classroom, we will not be addressing a specific person's disease pathology. We will be going over like general things. So what are good brain boosting, or something that is more nervine or tonifying the brain tissue. So those kind of things we will definitely discuss as the chapter comes. Then I think I see somebody asking about an example of health related problem that has been solved with Ayurveda. There are numerous problems that have been solved with Ayurveda. As you can understand, many like psychosomatic and neuromusculoskeletal diseases, or even skin conditions that have really no remedy with Western medicine, those people are left to just take prescription medications, which do give them a lot of side effects. Some people cannot tolerate that. Some people are finding alternative options. And so when a patient comes to a Ayurveda practitioner, usually they have like this whole baggage of unsuccessful uh, treatment history. And so we do treat, and we can help a lot of these people with uh, many conditions. Now, some of the examples, if you want me to give, are some metabolic conditions, which includes diabetes, like even insulin dependent diabetes. We help people with PCOD, women with polycystic ovaries, women with other hormonal imbalances, including thyroid. Then we have very successful treatments for heart conditions, cholesterol, heart disease, or hypertension. Then for insomnia or anxiety, we have very good remedies that are really life changing to those people. And infertility issues, or if it is related to aches and pains, chronic fatigue or energy issues, we do have so many remedies. Any pathological conditions that are diagnosed but not having any etiology or not having any concrete solution in Western science, Ayurveda has a good scope. If the patient is also ready to get completely involved, because this is not like just giving a pill to somebody. The patient has to participate completely uh, in their health journey. It's like a collective effort. It's a teamwork. So in Ayurveda, we say Vaidya, Aushad, Paricharak, and Rogi. All components have to give their 100%. So a caretaker, a family member, the patient himself has to be motivated, himself herself, to be committed to this whole protocol. Sometimes it may go on for 1 or 2 years. I mean, depending upon how chronic or how severe your condition is and how messed up it is, with lot of treatments that have delivered more side effects or aggravated, those symptoms, or created more new symptoms. So all depends on that. But yes, we do have many successful, like Parkinson's, anything you can call, and we have good. The only problem with Ayurveda is we had not kept for all these years. People had not kept very good data. Now that we are advancing it more scientifically and more in the Western world, we have people who have started putting towards together proper data, and also statistics, and also there are a lot of research, uh, clinical trials research, and case studies, or what we call as evidence-based medicine. Those things are getting documented, so we can, if somebody asks for a particular thing, we can show them the data with numbers, and with specific remedies. Now also remember, this is a very individualized treatment. So if one person has arthritis and takes a certain type of treatment from a vaidya in India or here, and another person comes with a similar type of arthritis, he may not receive exactly the same thing. So one of the flaws of Ayurveda versus Western medicine is we cannot exactly copy paste. We will have to make some individual, changes, because every person can have a similar disease pathology but display different symptomatology. So it's a very, very interesting to see how every person responds. So we give different remedies, different doses, and that's why collecting a data becomes little hard, though there are certain factors which kind of string them all together, and that is what those parameters are, what we use for any of statistics. Okay, let's see if there are any more questions. And then I think we have one more student who was available today to
I
talk.
don't see Rajendra
Ankurji, do we
G.
have?
Is he on? If you are, please raise your hand. Let me know. Any other students that would like to make a testimony? I see Vijay Kane G. You asked your question, but I know Vijay G, friend of HUA in Houston. Oh, Preeti on the iPhone. Is that you? And Vijay Kane, I'll get you as a panelist as well. Let's see. You should be able to unmute and turn on your camera to accept the panelist promotion.
Okay, I think I see somebody also with um, not having a lot of success with whatever remedies and treatments they took in India, with like, and also some of the problems that they had were not, could not have relief. So very sad to hear this, that you could not have relief in your uh, problems, that you had taken Ayurvedic remedies. But I would suggest it might have just uh, been like just one unfortunate incident. I'm sure you will be able to if you are, pursuing this course, and you will know a little more about yourself or whoever needs the treatment, maybe they can still get some benefit, or maybe somebody else can help them, like some other Ayurvedic Vaidya can be of help. So I would say, just by not having a success, don't give up. The science of Ayurveda is very ancient, very time tested, and yes, unfortunately, sometimes things don't work out the way we want, or take longer time than what we want, how soon we want to get benefited. So it could be one of those things. So maybe changing some medication, changing the physician, or taking the treatment for a little longer time could help in showing you some results. And I hope the best for you. Okay. Yeah, if Rajendra ji is available, then we can have him. Um, Anybody has any other questions?
Namaste. This is Vijay Karni from the Houston area. I'm a volunteer here with the Hindu University of America, and I'm myself a excuse me. I'm myself a student of Ayurveda. I've taken a few courses at Hindu University. I have not taken yours yet. I have attended one of your webinars. I'm hoping to do that soon.
Yes.
And my goal is to popularize Ayurveda more and get it more recognized by our own Indian American population. And I'm here in the
Yes.
Houston area. And the point that you made earlier is so correct, that people go to Ayurveda as a last resort after
Yes.
allopathy has not worked, and people are just so frustrated. And I think the core point of this course is the prevention side, that perhaps you would not have a lot of those issues if you just
Yeah.
use your Indian kitchen to
Yes.
prevent these issues. And I had a chance to meet Dr. Subhash Ranade before he
Yes. He
passed
was
away.
my professor.
Okay, yeah. So,
Yes.
and who was also a mentor for Dr. Mark Halpern, who I've met a few times over here, and
Yes.
I've been listening to his YouTube videos. So I'm enjoying the journey, and I'm certainly hoping to be able to take your course here real soon. And
Right.
incidentally, I met one of your classmates in Pune when I was there. He runs the Ayurveda Rasashala.
Oh, okay.
Uh, I forget his
Is it?
name. He gave me his card.
Oh, okay. One of the like, he's my senior. Is it Dr. Akkal Kotkar? Was
No,
it
no,
Mandar Akkal Kotkar?
no. It was. Is it Kulkarni or I?
Well, Dr. P.H. Kulkarni is, he was also our very senior professor,
Okay, yeah.
but he passed away last year. He
No, no,
was
no.
96 years
No,
old.
no. I think I got the name wrong. But anyway, I wasn't prepared to mention his name.
Sure, sure, sure.
But so when
Yeah.
I mentioned your name to him, and he said, "Oh, she was my
Right.
classmate." And that's
Yeah, that
what
would be very
what a
nice.
small
Yeah,
world.
maybe Dhananjay Kulkarni. Maybe he is with RAV with yeah, he's my classmate, and I didn't know he's with Rasashala, but he's with the Rashtriya Ayurved Vidyapith in India. And a lot of my classmates are actually, they're senior now, that they are principals of some of the Ayurveda college, or
Yeah.
they have good position with the Ministry of Ayush. So it's very nice to see them hold these positions, and together we can take Ayurveda to the next level. Here in the US, we are trying our level best through our organizations of accreditation council, and through the credentialing, and here local in Ayurveda Association of Florida, we do annual conferences.
Cool.
So any of you would be free in November, I would really encourage you to join our annual conference in Tampa. And this year it is going to be hosted at the University of South Florida in Tampa campus, which is also a medical college. So now we see that a lot of interest coming from integrative medicine departments in different hospitals. Like we have Tampa General Hospital and Baycare here in the Tampa region, which are very big medical systems. And they are showing a lot of interest to a point where they want to open a department of Ayurveda. So we want eventually Ayurveda, as you mentioned, to be a mainstream, like one of the choices that patients would make to go to, like a naturopath or a chiropractor or a family medicine doctor. So we want Ayurveda to be kind of in that line. But that will be a uphill battle. We have to go state by state and try to get it recognized as a legal medical science. And we are on the on the ladder for that, but it will be a few steps to climb. And in this November 7, 8, 9 conference in Tampa, we will have legal people, senators, lobbyists, all those people to discuss this in person, because we need to have a reality check. We need to know, like, yes, is this possible? How is it possible? We are not going to take no for an answer. So we have to think out of the box. We have to make changes in the legislature and policy making, and all these things are doable. Many, like every year we invite these politicians, and what we come to know is these things are not happening just because they don't know. So if we put a proper protocol for things to happen, it will happen.
If we also approach it more from the angle of nutrition,
Yes.
there is a little better chance that it will get. Actually, I talked to Mahadevanji and also Dr. Halpern
Yes.
to see if we can do some local workshops. Because
Yeah.
Orlando is a little far for people from Houston, for your retreats.
Yeah,
And if
so
we can
there
do
are
some,
many, there are many Ayurvedic Vaidyas that some of them may be associated with Hindu University of America that are in Houston, and they can definitely do local workshops, or online is also a popular medium. So we have, several doctors in the HUA faculty that can do something like that if online is possible. So
I'll reach out to you
Great. Yeah, and
separately later. Okay.
yeah, and
Thank
definitely.
you.
I'm right here at this Gujarati Physicians Conference in Atlanta, and we're pushing our
Right,
new
you are in
principles.
Wait.
Atlanta, so
Yeah, the principles of Ayurvedic medicine that we're launching exactly to mainstream Ayurveda, and we're approaching this from many different angles. All right, we have Priti ji. Go ahead and share your thoughts, and we'll have Vimla ji again.
Yeah, I have a question. Like, I want to know, I'm fighting lung cancer for last 2 years, and I want to know if there is a best Ayurvedic hospital in India where I can go and take the treatment.
So, yeah, we have some Ayurveda doctors who work in Tata Hospital in Mumbai. So I can provide you some of the contacts. Dr. Nitin Kochar and Dr. Varanj Khedkar are
Okay.
two people who work with the Tata Cancer Center in Mumbai. So you
Sure.
can
Yeah.
have like the best of both worlds. So we can
Yeah.
definitely connect you with those.
Sure.
I
How
also
about
saw one
the
question. Yeah.
how about the Art of Living Bangalore Hospital?
Yeah, I'm sure, but I don't know anybody personally over there. I know the
Okay.
people who work in the allopathic hospital of Tata Cancer in
Mm-hmm.
Mumbai. So that's why I said about that.
Oh,
If you
okay.
want to just go to a Ayurveda facility,
Yeah.
yes, you
I
can
wanted to go to Ayurveda only. No more
Okay,
allopathy.
then in that case, yeah, Bangalore Center or any other place in Coimbatore, Ayurveda Shala, those can
Okay.
be also good
Oh,
options. I
you don't
heard,
really know
I,
the
I,
particular one. Yeah.
no, I won't know a particular
Okay.
doctor there.
Not a
So
problem.
any this course we are giving it, we gave it last year in summer semester. This year again we are giving. Of course it will be given some other time also. If you can't just do the 14 July 1 class, the recordings are available. So if you want to join, and if you're going to miss one or two classes due to your prior travel schedule or any other commitments, the recording will be available, and you can still continue with the rest of the course. if just 1 or 2 classes are missing, I don't think that will be a very big problem. I try to adjust some students who cannot show up. There is, of course, a minimum attendance requirement. So if, as far as you can fulfill that, you can finish all your homework and your all the assignments, you can take this course.
Great.
Hi,
Let's hear from Preeti
this,
now. Preeti Shah.
yeah, hi. Ayurveda, is a blessing because I use it all the time for my family, for myself. I was so passionate. I went to Rishikesh and I did the nutritionist course. Dr. Vinod was amazing. I want to venture more into deeper classes and deeper understanding of Ayurveda because I use some of it for my father who's 90 with pulmonary fibrosis, but don't know much about how I can help him more. I'm on a very basic level, so, but I do want to learn more, and I would love the guidance from you on how I can be better. This is amazing. It's a beautiful way
Yes,
to.
it's a very good science, and for any age group we can use, which is a good part, and any stage of the disease. So when I say any stage of the disease, we will have certain limitations. If he has an advanced case of pulmonary fibrosis,
Yes.
certain remedies can help him ease with his day-to-day challenges, some of the inflammatory condition, or like many times we may not be able to directly help the patient to a large extent, but at least one thing, some people say that at least was helpful, which is cutting down on some of the very harsh medicine they have to take. So if he has to take like any cortisone, any anti-inflammatory that are very harsh on him, we can whatever else we add to his diet, lifestyle, or any herbal teas, or things he takes, that will at least cut down on the doses. So every time he goes to the doctor, he doesn't have to keep on like increasing the dose, thereby increasing more side effects.
Okay. Okay, you are there, so I'll definitely connect with you. Thank you. I appreciate that. And by the way, because I treated him a little bit, we did bring it down from 10 to 7.5. I still wanted to
Right.
go
So see,
down.
that itself is a great achievement. And the
Thank
more you know about anti-inflammatory or anti-fibrotic substances, you can start incorporating those in his food, in his surroundings, and you will start seeing definitely the disease may not get worse. That
Correct.
is the thing, sometimes you have to, like in Ayurveda also, they say that some vyadhis are incurable. They're not fatal, they may not kill you, but you may have to live with them. And while living with them, how to make it bearable, so they are called kashta sadhya, or like very hard to deal with. But that is where you need all the family members, and the medicine also needs to be very potent. A lot of times we see medicine itself may be hard to buy, obtain, or get a proper supply from India. Sometimes they may have adulterations. Sometimes they may, have like expired or very old, or very, like unprofessionally prepared sometimes, because I mean it's all uh, things. So we try to source medicines also, like here, from more ethical, moral sources, so that there are hardly any chances of adulteration, or like it is done properly as per indications in Ayurvedic pharmacology. One quick example is, sometimes they say like one popular medicine recently came to my attention, Shilajit. So in Ayurveda, we use Shilajit, but it has to be Shuddha Shilajit. Ayurveda never uses Shilajit on its own. So if somebody is taking Shilajit from, the natural mountains and resources, and just dumping it in some formula, that is a very wrong way to do that. Same thing with Google. So Ayurveda has a whole process of shodhana or shuddhikarana, or making it, in pharmacological terms, it will be more bioavailable. So for you to have a cholesterol being lowered with Google, it has to be a Shuddha Google made in the scientific Ayurvedic methodology of pharmacy protocols that have been, in use for thousands of years. Unless it is done like that, it will not show the efficacy. Now, a lot of these modern pharmaceuticals, what they do is they extract active ingredients or alkaloids from that plant and they call it like Ayurvedic remedy. It doesn't work like that. So these are like little things that have to be brought to people's attention before Ayurveda gets a bad name that, oh, this doesn't help. Because
Okay.
it will not help. It is not done the way it should be done, right? So anything that needs to be soaked for example, Shilajit has to be soaked in cow's urine for like 24 hours or whatever the suggestions are traditional, it has a science behind it. So we can try to learn and extract more scientific reason why this is suggested or what exactly happens when this is done. But so medicine and sourcing is very important. We are trying to, in US, trying to, figure that out, because that's a whole another thing that
Right.
we need to also focus
Excellent.
as we are trying to standardize Ayurvedic medicine into the mainstream.
Perfect. Excellent. Thank you.
Okay, I see one more question here about no, so the existing treatment doesn't have to be discontinued when you are taking Ayurvedic medicine. We never recommend that at all, because Ayurveda is not a legal and licensed practice of medicine in America yet. In India, you could have a choice. You can go to Ayurvedic doctor, not go to a allopathic doctor at all, and you can just continue treatment with Ayurvedic doctor. In this country, we will not suggest you any of these things, because we are not legal licensed as a independent medical practice yet. Whenever that happens, maybe. But right now, if you are taking a treatment from an allopathic Western doctor, you certainly continue that. You will be better if you have a holistic practitioner. So many Western doctors, gynecologist or rheumatologist or any diabetic specialist, they are doing integrated medicine course or functional medicine course, and then they get introduced to Ayurveda. So if you find a holistic doctor to be your primary care doctor or to be your specialist, that will be very, very helpful, because at least Ayurveda practitioner can have a good open dialogue and proper communication with them, and we can together help the patient. So that is something we can do, but this is not like a either or. At this time of time in history of Ayurveda, we still need to continue using allopathic medicine if that is what you're undergoing that treatment, and only if you decide to against medical wish, or your holistic practitioner says, yeah, I can wean you off your prescription meds, you're doing very well with Ayurveda, and that can be attainable. And I can give you some examples. I have a very close friend, and they don't live here, they are in Phoenix, but they uh, he took Ayurvedic remedies for his insulin dependent diabetes, which was he was on it for like 16 years. But as he started taking Ayurvedic herbs, it started reducing to such an extent that the allopathic doctor completely weaned him off, and for last 4 years he's not taking any insulin at all. But this could only be possible not because I can tell him to do so. It is because his diabetic doctor was a holistic doctor, and he said, yes, you're doing so good, so I'm going to slowly wean you off. And he's put him off insulin for 4 years and monitoring him well, and all his A1C and everything is within normal limits. So it's not just something just happened, it's been monitored for last over 4 years. And I met him in March, so I can it just came up that I was in Phoenix in March, so I could get to see him. And so many such things can be done. I used to work for a rheumatologist right here in Orlando, Dr. Bashish is retired now, but I used to work with him for a lot of his patients with rheumatoid arthritis, because for RA patients, he said the onset is at a very young age. All he does is every time the patient comes, he has to just increase the dose of prednisone, methotrexate, and he said, I feel it very criminal to do that. They are like in their 30s, and putting them on these medicine, which is a high risk of a lot of side effects for the rest of their life. I know that this is not treating their condition at all. It is just buying them more time to get worse and worse. So I used to work through his clinic, and we uh, used to give them like remedies of oil and Ayurvedic herbs, and for a lot of them he cut them off their prescription meds for good, like for lifelong. So, but of course, they had to follow diet, lifestyle, and regular checkups, like a yearly follow up with him, to make sure that their, whatever their immuno uh, markers are all under control, and they are not advancing in the disease pathology. So, if you have somebody to work with like this, and more holistic doctors are coming up, till we get Ayurveda to be a credible licensed medical practice, we can definitely follow this kind of a give and take, and help the patients.
Ankurji, if you have a couple of minutes, I have a couple of quick points to make.
Sure.
Yeah, this is Vijay Kane again. Yeah, so a couple of things that you, in your answer that you mentioned about the person with diabetes. So there's this organization here called SVyasa, and it's located in the vicinity of Bangalore. We have a big extension over here. Okay, starting the video. Okay, yeah, we have an extension. And so they have a Stop Diabetes Movement camp. It goes for 10 days, instruction of 2 hours every day. So a total of about 20 hours. They don't even talk about diets. It's purely done by yoga. And
Oh, yes.
there are a couple
I
of,
remember.
yeah.
You probably know Savita Joshi. Are you familiar with her?
I've heard her name.
Yoga Bharati.
Yeah,
She did a webinar on our Ayurveda Association of Florida monthly webinars, and she did talk about treating diabetes with yogic kriyas, including pranayama, and she
Yeah.
gave a demonstration. And she was from SY
Yes,
USA.
yes, yeah. So my wife and I actually took this, and my wife actually dropped her A1C from 6.5 down to 5.7. Now she has lapsed a little bit because I tell her that any unusual accomplishment takes unusual sacrifice. And so the point I wanted to make was that you mentioned about Ayurvedic approach to this. So if people actually combine these two, so there were a couple of endocrinologists, uh, American endocrinologists of Indian origin that were here, and I was having a chat with them, and I asked them, I said, and they're big believers of yoga themselves, they're practitioners of yoga themselves, and I asked them, I said, have you been able to reduce your patients' doses? And they said, yes, people have come down to metformin from insulin, and there are people that were on metformin, their doses were dropped. Another point I wanted to make was I'm glad you mentioned about in all the Indian stores over here, we have all of these things, ashwagandhas and trifalas and everything. And there are a lot of people that know me, I'm taking courses in Ayurveda, and they always ask me this question, is this good? Is this good? Is this good? And I say, you know what? I'm not going to answer that question, because you really need to get an Ayurvedic consultation done, because the effectiveness of taking these things, they say, well, these things have no side effects, and I don't think that's true, because at least the effectiveness and the timing and the way you take these off the counter medication, Ayurvedic medications, depends on your Prakriti and your individualized situation. So you have to take an Ayurvedic consultation, and then you get on these things. And you made that point earlier, and I just wanted to kind of
Yeah, that
emphasize
is
it.
true.
Yeah.
Ayurveda has a whole science of how to take herbs, when to take them, what is the best time based on your dosha, but also based on the herb, like when the herb is its availability of its medicinal components is most mature or ripe. So there are many things in that. And this is another thing, like, Ayurveda is not really regulated in USA, and also to some extent in India. So it has to start from the root. And here we see a lot of advertisements, right? In America also we see advertisements on TV. Ask your doctor if this medicine is good for you.
Yeah.
So we could advertise something like that, like, yeah, ashwagandha, very popular, but is it really good for you? Because if you have a very high hypertension or a lot of like heat issues, like maybe migraine or acid reflux, that can actually be very, very bad for you. It can increase too much of heat, and it can overstimulate you and cause more harm than good. So, just taking like one herb like shilajit or ashwagandha or like something else that has just gained popularity, and use it for like without anybody monitoring it for any amount of time. So another misconception is, oh, Ayurveda has no side effect, so you can just go on and on and on, years and years and years using it. That is very, very wrong way to do anything, because these are still medicines. Okay, you don't have to need you don't need medicine to stay alive every day. All you need is food, air, water, and good clean environment. So Ayurveda has a very distinction, a very properly separated ahara dravya, which is good for your survival of your everyday use. So anything in the ahara dravya category, that is your food, that can be used as medicine. But Aushadhi Dravya, which is specifically for Aushadhi, for remedies for your imbalances, for your diseases, that only has to be used as Aushadhi. Ashwagandha does not come as a Ahara Dravya, it comes as a Aushadhi Dravya. So, Ashwagandha, I have heard many people saying, I put like a scoop of Ashwagandha in my smoothie every day. I'm like, what for? Who recommended you? No, I thought it is good for you.
Yeah.
So these things we need to debunk, and we need to say, okay, this is not a ahara dravya, this is a aushadhi dravya. Medicine has to be taken only if you have a condition or a reason to take that medicine. Every day you only eat ahara. Is turmeric a ahara dravya? Yes. Turmeric, cumin, cilantro, these are ahara dravyas. So Ayurveda has classified that. Now, can you increase the dose? Every day you can take about quarter teaspoon of turmeric in your cooking, in your milk, in whatever you want. But if you have cancer, we may say, okay, for next 2 months, take 1 teaspoon of turmeric instead of quarter teaspoon. So these things can be, but that is still ahara dravya, so you can safely take it every day. So this distinction has to be made, and people have to be educated for that. We have to educate the population that just because it doesn't create side effects. First of all, that is also a misunderstanding. Any medicine, when taken inappropriately or without a reason, will create damages.
Yeah. Try taking 2 spoonfuls of black pepper and see what happens. By the way, I got that name, Dr. Suhas Madhukar Kulkarni.
Yeah, Suhas Kulkarni is my classmate.
He's
yes.
the general manager of Ayurveda Rasashala.
Okay, I will
Dr.
I will
Ranade,
let him know about you.
yeah, Dr. Ranade arranged a private tour for me to go visit. And I loved it.
Yes.
When you see how these things are made and how
Yes.
much pain is taken in preparing each one of them, all the boiling pots and all the grinding and the mixing of the right proportions. And it's all done. There's a whole science there. It's not just so I'm so glad you emphasized that point. All these things are available off the counter and people just start using them. So, okay, that's enough for me. Thank you.
Okay, anybody has any more questions, or are you all ready to sign up for the course? I think it will be an exciting journey of 10 weeks. Yeah, somebody asked if ulcerative colitis, Ayurveda can help in that. Absolutely, yes. And also for plaque, yes. So lot of these things can be treated very successfully with Ayurvedic remedies. There are certain pathological conditions that need more evaluation from on like a one-on-one consultation. But we will discuss in the course, we will discuss general remedies for various conditions. And we have like a good material that we share with all of you. So you will have access to the PowerPoint slides. You will also take your own notes when the class is going, and you will have access to the recording. So even if you don't take notes, everything that we discuss, everything that we share will be in the recordings. And as I mentioned, even if you miss the class, you will have access to everything.
So let's hear from iYoga Transformation. Sorry, I don't have your name. If you want to introduce yourself, I think I saw your question.
Hi, my name is Amala. First of all, I want to thank our host for taking the time and providing information about Ayurveda. I am a yoga teacher, and I totally agree with what he mentioned about people taking these natural remedies as everyday intake, and it's not supposed to be that way. But also, I want to ask a question, and that is, my understanding is Ayurveda is mostly used for prevention or maintaining the symptoms of a disease, and not necessarily fully curing a disease. I know myself by experience that I have more or less got rid of a lot of my shortfall in life as far as my health goes by practicing yoga, or my diet and intake, and being more onto natural remedies. But to be honest with you, I have not. I have yet to see Ayurveda approach to be actually cure a disease. And disease I am talking about it, not a health imbalance, but the actual disease. So can you put some light on that, please?
Yeah, certainly. When you are saying a disease is basically disease is a pathology which happens in an organ or a system. So in
Correct.
Ayurveda, we are think about one thing. The modern science is hardly like 150 years old. Before
Mhm.
that, everybody was getting treated with something that is their traditional medicine. Ayurveda happens to be the traditional medicine in the in the, like, if you look at the geographical area, I would say most of the uh, like the Indian subcontinent all the way to China, because we see roots of Chinese medicine also in Ayurveda, Tibetan medicine. So this was like the medicine that treated all diseases, all disorders. It is very evolved in its remedies, in its like understanding of the various disease pathologies. And so here, if you don't find the actual treatments being given, the only reason for that is because it's not a licensed system of medicine where people can just go to Ayurvedic doctor and fix themselves. So the last 150 plus years, the Western medicine or allopathic medicine has become so popular, and because of its the way that it can be used, like the remedies can be exactly replicated. So if you take a paracetamol, and if anybody on the whole earth takes paracetamol, the remedy that it is given to lower your fever or whatever, that is how it works. So in Ayurveda we have some such remedies. We call it Vyadhi Pratyanik Chikitsa. But just because the whole globalization of Western medicine has become so popular, so anybody is sick, you first go to a allopathic doctor or to a hospital, which is pretty much controlled by the allopathic doctors. And this really has remained in the background. Even in India, we were ruled by the British for a very long time. So even within India, to get a proper Ayurvedic education or a proper Ayurvedic practice, it used to be very hard. Now that the popularity is getting back, there's a whole ministry of Ayush that has been started for Ayurveda and yoga and all that. So we have last 10 years is showing like much more progress in terms of remedial uses of Ayurveda. So in India, of course, you can have a complete choice. It is legal and it is a licensed practice of medicine. So if you don't want to go to allopathic doctor and you just want to go to a Ayurvedic doctor, you can do so. You can get completely treated for your condition. And there is also something called integrative approach, where you can use allopathic medicine in case of emergency or when the disease pathology is in a critical stage where it is like life and death situation. You don't want to if like a CPR is done and your life is going to be saved, you can do that. Or like if there is a surgery that is required, we don't do Ayurvedic surgeries anymore, with Sushruta's being the father of surgery. So the integrative approach can be an ideal model where allopathy can be used as and when needed. Ayurveda can be used for most of the other times, and it doesn't have to be either or. It can be this and that as needed when needed, because you see, modern medicine is very advanced. They can really save the life when it comes like you are like smashed by a car. You may have more chances of going into the ER and getting your life back. So we are not competing with anybody. Every science has their limitation, and
Mhm.
we want to use Ayurveda for all the metabolic disorders. We want to use Ayurveda for skin conditions, for infertility, for anything that is related to things that are created by us. So lot of the food, diet, lifestyle, habits, stress, way of thinking, these are all the disease producing components. So all those things, if we can use to prevent the disease. But again, remember, prevention in Western concept in allopathic medicine is early diagnosis, right? They ask you to go for a yearly mammogram, yearly stress test, yearly EKG, yearly some PET scan, whatever scan. So that they want to do a early diagnosis. They are not giving you a whole protocol to prevent getting sick. In
Right.
Ayurveda, what we are going to recommend you,
To
things to
prevent.
identify with your body type to prevent you from getting sick. That is like the real prevention. That's not early detection. That's just prevention from actually falling sick, and also maintenance of health. So we have something called Panchakarma, like you do your vehicle maintenance, right? Your vehicle, your car is a mechanical a machine that needs oiling, lubrication, maintenance of the engine, and just getting all the basic checks done. Similarly, in Ayurveda, we have a Panchakarma for maintenance of health. So it is like a yearly protocol that you can do for as your annual checkup. So when I was practicing in New York many years, there used to be patients who were like apparently quite healthy. They were just following good healthy lifestyle, doing yoga, being vegetarian, being active. Even mentally, they were like happy people trying to overcome their problems by more meditation, yoga, pranayama, all those things. So they used to come and they say, oh, we don't buy any insurance. We just come here once a year, get our pulse checked from you, and then you tell us whatever we need to do or not to do, and then we come back next year. So Ayurveda can be like that. It can be working as just like a yearly health checkup, that you need to take care of
And I,
this, or you
I
need to address this. And that I used to feel quite very elated that people think of Ayurveda like that. And they were just coming that, oh, we are healthy, we don't have to buy insurance, because it's thousands of dollars, right? So many people opt out of insurance just because what is under our control, if we try our best to maintain that, there are 99 50% less chances of falling sick with our own wrongdoings. Yes, accident happens, something happens, so you can of course have an incidental insurance, which
Mm.
unfortunately has high deductible, high
Also,
premium.
I
But
think the Ayurveda is a slow response to a disease like myself when I was going through menopause. I never took any medicine, and I was taking Ayurvedic remedies, and I never really experienced the menopause like my friends did. Um, or on my daily life, I'm taking all kind of different spices and all that every day to prevent getting sick or coming out of my discomfort or whatever. But the healing through Ayurvedic is very slow. It's just like taking yoga. It doesn't happen with one time practice. You have to have a lifetime practice with whether it's Ayurvedic, whether it's yoga. That's how you get result. It's not like you can have cancer and you can take this spice and become cured, right?
okay, so for that, even with cancer, with allopathic medicine, they're not really curing you. They are trying to kill some cells here and there, and then leave the people with so
Right.
many complications and side effects. And then, of course, if it is non-curable cancer, the people die with more suffering. So with allopathy, with Ayurveda, what I would say is it's not necessarily it is slow, but it is more like a commitment to self. Okay, so it is about, like, whether in the morning you want to eat like a piece of cake, or you want to eat something like a warm breakfast with say ginger tea. So it's about that. It's not necessarily something takes long or something. Yeah, lifetime commitment, because that is what you want to do to yourself. Here I in Florida, actually, we see a lot of older patients, older people around us that are retirees, and they are busy just visiting from one doctor to another. So all their lifetime savings that they want to now enjoy life is all gone into visiting every day. Like, they're busy, they're more busy than when they were working, because now they have doctor's appointments, right?
True,
So
true.
instead of that, nowadays there is like more trend. People who get early retirement and come here and settle here, they're like, okay, now we want to focus. We have the money, we have secured our retirement planning. Now we want to really take care of ourselves, so that we can be fit and healthy and not be with the doctor all the time. And that is the kind of so if you have that commitment, this will not be like burdensome. Oh, I have to do yoga every day. Yeah, you want to do yoga every day because that makes you feel healthy,
Good.
feels active, alive. It also on the side helps you to keep flexible, not have arthritis. So I would say eating healthy, having yoga, having meditation, having a healthy lifestyle, or good thought process, good thinking, will be more of a lifestyle choice that you make. And having prophylactic uh, measures out of it will be an added bonus. So
Thank you.
All right. I put more details of the course in the chat. Please do register. Just wrapping up here, Aparna-ji, I'm sorry that I wasn't a better host today, but I still sounded like a great webinar. Glad we had all of our guests and former students join us and give their testimonials. Let me make that last close. Please do enroll. This is an amazing course. Aparna-ji is great. You heard it. So with that, let me just hand it to Aparna-ji for her closing statement.
okay, so I guess whatever questions you had, we tried to answer them in as briefly as we could in this just 1 hour time that we have for this webinar. If you have if you have already decided to join the course, I'm sure you will be very happy taking this, and you would enjoy, and we can have many more interactions and lot of knowledge exchange. I learn a lot from my students, so it's not just one way. We always want to know more, and how we can collectively uplift Ayurveda to a place where we can have that as a established medical system, and also covered by insurance, so more and more people can take advantage of this. And yeah, do join our course, and hope we can learn all this together. Namaste. Thank you so much.